Today, we're going to look at a body viz brain builder about the thoracic cage and a pneumothorax. The thoracic cage surrounds and protects some of the most vital organs and supports the pectoral girdle. The ribs are flat bones, and the costal cartilage consists of hyaline cartilage. There are 12 pairs of ribs that are subdivided into 3 different types of ribs. Ribs 1 through 7 are called true or vertebrosternal ribs. Each of these ribs connects anteriorly to the sternum with separate individual costal cartilages. Ribs 8, 9, and 10 are called false or vertebrochondral ribs because they do not connect directly to the sternum by separate individual cartilages. Instead, the costal cartilages of the false ribs fuse together before attaching to the sternum. Ribs 11 and 12 are called floating ribs because they do not attach to the sternum at all. The vertebral end of each rib possesses a head, neck, and 1 or more articular faucets. The head articulates with the thoracic region of the vertebral column. As you move anteriorly, you will encounter a shorter neck of the rib. On ribs 1 through 10, you will find a posteriorly projecting tubercle that articulates with the transverse process of the thoracic vertebrae. Ribs 11 and 12 do not possess such tubercles and do not articulate with the transverse process of any vertebrae. The sternum is the center of your chest and connects ribs 1 through 10 anteriorly. The sternum is composed of 3 parts that develop independently. These 3 parts typically fuse together around the age of 25. The manubrium is the most superior part and articulates with the clavicles of the appendicular skeleton and the costal cartilages of the first pair of ribs. The body of the sternum is between the manubrium, superiorly, and the costal cartilages of ribs 2 through 10 laterally. The xiphoid process is the most inferior and the smallest part of the sternum. A cracked or fractured rib is a common injury. Ribs 4 through 9 are the most common to be fractured because they are more laterally located. If a rib is fractured into 2 or more pieces, injury to blood vessels, nerves, and/or an organ of the thoracic abdominal cavity are possible concerns. A punctured lung or a lacerated aorta are both life-threatening injuries that may occur with a severe fracture to 1 or more ribs. The more ribs broken, the higher chance of internal injuries. A pneumothorax is a life-threatening injury and results when air enters the thoracic cavity through a puncture of the chest wall. This causes an increase in the intrathoracic pressure and will cause a partial or total collapse of 1 or both lungs. Let's discuss more about the symptoms, causes, and treatments of a pneumothorax and see a patient example. There are 2 main symptoms of a pneumothorax: sudden chest pain and shortness of breath. The severity of the symptoms may vary with how much of the lung is collapsed. Causes of a pneumothorax are chest injury, like a blunt or penetrating injury, causing the lung to collapse. An example of this would be a blunt injury causing multiple ribs to fracture and the pieces of the ribs to puncture a lung. Lung diseases are another cause because they can create thin-walled air sacs in the lung tissue that can eventually rupture. Ruptured air blisters are another and final cause. Small air blisters, called blebs, can develop on the top of the lungs and sometimes burst, which can cause air to leak into the space around the lungs. The typical treatment for a pneumothorax involves sealing the chest wall, and next inserting a needle through the chest wall and into the thoracic cavity. Suction is applied through the needle to remove excess air from the thoracic cavity. Typically, as the intrathoracic pressure decreases, the collapsed lung re-inflates. Depending on the severity of the air leak and if the lung is re-expanding or not, there are other surgical and non-surgical treatment options that may be used to close the air leak. Finally, let's take a look at a patient example. You are working in the ER when you are notified of a patient on the way in an ambulance. You look at the notes from the dispatch call. Patient age, 21. Gender, male. Chief complaints, chest pain and difficulty breathing. When the patient arrives, they are struggling to breathe, and you can see only one side of their chest inflating. The EMT and paramedics inform you that this patient was in a fight and they believe broke multiple ribs. You listen with a stethoscope, and you can hear whistling on the left lung that is not inflating. The whistling noise is the air leaking into the thoracic cavity. You insert a needle for aspiration, and as the air is relieved, the lung begins to re-inflate. After the patient is breathing steadily, you order an X-ray and confirm the EMT's and paramedics' hypothesis of broken ribs. This is a classic example of a pneumothorax caused by fractured ribs. Please like this video and follow for more 3D anatomy.